Right, so that moves us on to our next area. Okay, getting progressively more common, over treatment. Now, we've got to keep in mind as chiropractors of the view that chiropractic is part of your lifestyle. It can be a good thing. You don't have to have symptoms to necessarily see a chiropractor. So why are we getting allegations that revolve around over-treatment?
John, do you want to start?
I think it all starts with the report on findings, to be frank, and the recommendations given in the report on findings. Essentially, if you recommend a course of treatment before you even start that treatment and see how the patient is progressing, which involves 36 treatments, you're going to be in trouble.
Yeah.
The report on findings should be documented. You should keep a copy of it, because that, for me, is one of the biggest failings of the chiropractors that I represent, that particularly in this field, that they don't keep a copy of their report on findings and what they recommend to their patients. So
just on that, are you talking about with the report of findings, the number of visits or the
number of visits
to
and the areas that they intend to treat?
Okay.
And with what form of treatment, whether it's diversified, ABC, whatever, because there are a range of chiropractic techniques, and whilst it's not necessary to go into huge detail with the patients about the type of techniques that you're going to be using, if it comes to a PCC hearing, they would expect to know whether you were going to give soft tissue treatment, diversified treatment, Timony, whatever. So that should appear on the report on findings, and the number of treatments that you initially recommend. Now, many chiropractors now, I think, are starting to recognise that the initial range of treatment should be for a dozen. And generally speaking, I think, Jonathan, it's the case that if that happens, there won't be any difficulties in terms of over-treating.
I think if the treatment plan is 12, you won't be before the PCC for that, generally speaking. Saying that,
about 24.
Well, this is the trouble, because there is no magic number.
Yeah,
there is no magic number, and the GCC will accept, and they have accepted on every case we've ever had with over-treatment charges. They've accepted that there is no magic number, and that chiropractic for life, in theory, is acceptable. It's a question of the frequency, it's a question of the numbers of treatments, and a question of the reasons for them. And in my view, you can recommend 12, you can recommend 24, you can recommend 36, if in your experience you think that is what the patient is likely to need. With one caveat: you make sure that at every single stage you review.
Yeah.
And that's the key. As long as you have a review built in to the treatment plan, built into the report of findings, and as long as the patient is aware of that, so that they know that at session 12 you're going to see what's happening, see whether or not you need to continue, recheck, decide whether or not the next 12 is necessary. As long as everyone knows that, and it's there and it's in writing and the patient is aware of it, you'll be fine. And the GCC and the PCC have, certainly in my experience, never found one of these over-treatment cases proved when a review is built in, because their reasoning is simply, well, it's a guesstimate based on the practitioner experience. They were going to see what happens after 12, and that's fine. If you want to be ultra cautious, just go for 12 each time, and you're never gonna pop up in front of the PCC. But as long as you have a review built in, I think you're okay. And there's nothing wrong, as I said, in principle, with people coming in to have chiropractic treatment every week. The difficulty, and again, it hasn't been tested really before the PCC, is that the three phases of treatment seem to be the way that they look at this. Pain relief.
Well, that's going to be my
your next question.
My
I'll leave
next
you
question
to
was that, and I suppose actually for our audience, just to put it into just in case you're bristling with the word treatment, the only reason that's been used is because that's what's used in allegations.
Yep.
And that the panel and GCC see it as treatment, they don't see it as adjustment. So it's just not
Or
adjustment,
care.
it's or care, or we like to use the word care, right? Care and adjustment, because treatment suggests, okay, there is something wrong, and it's not appropriate for people who are getting lifestyle care. But it is seen that chiropractic care involves more than just the adjustment, as you mentioned, nutritional advice, etc., and that all comes into it. So I suppose we could use the number of sessions. So do you think then it's good advice to explain to the member or the person, the individual in front of you, okay, this is what our short-term goals are. We're going to check them. This is what we expect to see. Then on this, we'll be looking to go to here, so you can give people the broader picture, because I think that's good practice.
Yeah.
So this is where we go, but give people choice.
Exactly.
And that's not just good advice. You have to do that.
Yeah.
You have to explain to the patient what your plan of care is, and what you anticipate. But the key is to make sure that the patient always understands that this is an estimate.
Yeah.
And it can change depending on how they react and how they respond to treatment. If you want to be careful, and I personally would recommend it, make sure that is in the patient consent form, that they have had the report of findings explained to them. Quite often you'll see on the chiropractic forms people tick whether they want pain relief, whether they want to address the underlying problem, whether they want to be pain-free forever, that sort of thing. And it's quite a nice thing for us lawyers to be able to say, oh, well, you said you wanted the rehabilitation as well, so clearly you were expecting more than 9 treatments. But there's nothing wrong in principle with saying to a patient, look, I'm signing you up for 36 treatments because in my experience that's what you're going to need, but we'll see how we go. We'll go with 12, we'll try 24 if we need to, etc., etc. Sign here to say you understand what we're talking about. It takes a second, and it can stop, well, dozens of these types of cases from coming to fruition.
It's all about communication.
Yeah.
Yes.
And managing expectation.
Yeah, and you know, a lot of patients will say, oh, we didn't see the road to recovery thing on the wall, and he didn't explain it, and etc., etc. If you've got it on paper, yes, it was explained, 12, 24, 36, but the key is 12 and then put an R next to it. Review, 24,
Yes.
R. You put that, I know it sounds ridiculous and semantics, but if you just put the R next to it, it shows that you were contemplating a review. And the number of cases we've spent hours questioning the chiropractor as to whether they really were going to review after 12 sessions. Most people formally review on every 12, and most chiropractors review at every session.
Yeah.
But if you can just say I was contemplating it, you'll be fine.
And we'll touch on review when we get into our section on note keeping.
Yeah.
But you've covered it pretty much where you talk about the 3-phase, because that is a common care approach that chiropractors use. They use a 3-phase, whether it be called the initial care or initial intensive care, whether it then be called either rehabilitation, corrective care, and then wellness care. So what you're saying is it's good to explain that to the person up front, and then say that we'll review, and then give you an opportunity whether you want to go to the next stage.
Absolutely, because obviously one of the other issues here is payment plans.
Yeah.
And your payment plans often reflect the estimate of care that you're looking for as well. So you'll take 36 payments up front to get a discount. Now, if you're going to do that, then you're effectively telling the patient, look, you might need 36 treatments.
Yeah.
And if you're going to tell the patient they might need 36 treatments, you've got to explain why. And if that means, because there's three sets of care involved in that, then that needs to be explained. The difficulty, again, sorry to come back to frequency, but again, just to give you an idea, the GCC, pain relief 9 to 12, not a problem. Rehabilitation twice a week for 3 or 4 weeks, not a problem. Maintenance, or what you call wellness, the frequency at that stage, that's debatable. The GCC experts will say once a month. Now, I know some chiropractors will be once a week. We haven't got into the semantics yet of whether once a month or once a week is acceptable. But if you want to be careful, I'd say 3 times a week or 4 times a week for the first 3 weeks, twice a week for the next however many for rehabilitation phase. And then you want to be careful, say once a month for the maintenance phase.
Right. Okay.
I mean, I think we should stress that we as lawyers are not really trying to prescribe to chiropractors how they treat patients, but all we're trying to do is to give a sort of indication as to the levels of treatment that a professional conduct committee would regard as reasonable.
Yeah, the reality is that the professional conduct committee tend to instruct one of 3 experts in all of the cases that come before them. And we've come across these experts time and time again, and they have fairly standard views on certain things.
Yep.
I'm not saying that those experts are necessarily always right. So the guidance we're giving is not so much, as John says, about treatment guidance. It's in our experience, this is the sort of thing that would be criticised. And if you do it this way, you won't get that criticism. I'm not saying that you have to follow that guidance, but as lawyers, we're trying to prevent, as you say, rather than cure.
And in terms of preventing complaints in the first place, we do see quite a lot of complaints that are made straight to the GCC rather than to the chiropractor.
Exactly.
About how the patient has come along expecting to have maybe a couple of treatments, and then being told they're going to have 24 and it's going to cost them thousands of pounds, and then they complain straight to the GCC. Now, often they don't get very far, they don't get past an investigating committee, but what you want to do is to prevent it going to an investigating committee in the first place, because it's very stressful and a hassle.
Yeah, not attract that attention. And I think the important thing too is everyone's an individual, and that is a good point. It's like John and John are not saying, okay, this is what you're not saying, okay, you need to, this is what frequency of care you must recommend. Everyone's an individual, but it is just what you've seen in your experience with fitness practice hearings,
Quite.
GCC.
Yeah.
Exactly.
Yeah, absolutely. Great. Thank you.